on this for going on the Facebook Live, and we appreciate being able to talk about childcare and the importance that it plays. So this is from the California Small Business Development Centers, as well as the California Women's Business Centers. We are two programs that are supported by the Governor's Office of Business and Economic Development, as well as the U.S. Small Business Administration to support small businesses, providing technical assistance. And so we appreciate you all getting on to learn more about what you can do to adapt your childcare business in these times. Would like to kick it off with Isabel Guzman and have her be able to kind of give us a welcome, as she's the small business advocate for the Governor's Office of Business and Economic Development. Isabel.
Thank you so much for having me. Again, I'm the director of the Office of the Small Business Advocate. We're an independent office that sits within the Governor's Office of Business and Economic Development, really focusing on providing information resources, advocating on small business behalf, and working towards their resiliency. So really pleased to be here with the WBC's Women's Business Centers and the Small Business Development Centers today. Thank you so much, Danny, for the warm welcome and for having me here. As Danny mentioned, the state of California supports the network of small business centers throughout the state of California. And it's, we've really been so pleased with the response that they've had to COVID-19 and their ability to disperse information, provide immediate support around the critical issues that small businesses want, whether that was immediately capital, now the guidance, you name it, strategy on getting digital, strategy on pivoting your business. They've been there on the ground. It's been a pleasure to partner with them, and so glad that you're all joining because this information is critical. We know that the world has changed around us. It is not going back to normal, and so this is something that all of us have to consider. How do we pivot, adapt, and figure out how to reopen safely, really for the safety of not only our employees and ourselves, but also of our consumers, our clients. Consumer preference and consumer demands are shifting, and so just being able to respond to it and implement your safe reopening is really important. I'm really pleased to be here, in particular on this childcare topic. And the reason I wanted to come is that, we know that every single small business convening that I'm in, one of the issues inevitably flagged is the fact that childcare is so critical and necessary. And so up until this point, it was, when was it going to open? And now it's about getting you guys up and running as soon as possible. Of course, for employees, it's impossible to bring your workforce back as employers and have them, focused and being able to focus on their work when childcare is a concern. So the work that you do is so integral to the whole economy. I just want to really thank you all for the work that you do. I mean, it's a very admirable choice of business, and I just want to let you know how important it is. In terms of what the state has been doing with the guidance, and I know you have some experts here that are going to dive into further detail. We've come this far today. We originally were in stage 1, where the essential workforce and businesses only were operating. And during that time, though, we saw how essential businesses, which included some childcare, started adapting. That's where a lot of these best practices came out in terms of plexiglass barriers or mask wearing and social distancing, the cues that you started to see in retail. So truly, the process of developing guidance has been embedded in how industry has responded as well. So as we're currently in stage 2 and coming out with all these guidance documents across the board, for stage 2, and then now heading into stage 3 in some counties that are moving forward faster. Just know that a lot of this has been industry informed. We at GoBiz have been involved in the process, as well as with CalOSHA, Department of Industrial Relations, the California Department of Public Health, and every different agency or relevant government been involved in the process to try to develop these guidance documents. But in addition to that, the stakeholders were involved in the process. So in industry and thought leaders who could help us with some of the practical issues in addition. So know that that's where this guidance was coming from the perspective of how can we make this all work for everybody. So building on all those those best practices and developing the guidance, hopefully the documents are helpful to you to walk through and understand some of the basics in terms of keeping your employees safe, keeping your place of employment as risk-free as possible, to try to keep your workforce and those who visit, the children at the childcare and everyone else as safe as possible. So with that in mind, know that the governor, as he's stated, is allowing for local county variation, and I'm sure the folks on this call will go into greater detail, but that's where you can really see where your county is at in terms of the advanced guidance. And the sites are at covid19.ca.gov, where you can find all the industry guidance, keep up to date in terms of where we're at in the roadmap. The governor has said that health and safety is paramount, and we're tracking all of this from that perspective to ensure that the state of California can rebound, of course, successfully from an economic perspective, but also that we retain the the health and safety of all Californians. And so with that in mind, I just want to again give thanks to the WBCs and the SBDCs for putting this guidance workshop together to really walk you through the process and figuring out how you can reopen safely. Know that we're here as a resource to you. You can find us at business.ca.gov. We're here to either provide direct assistance, redirect you to our centers who do an incredible job of that one-on-one consulting or training, and then also provide connection to other state resources, including capital programs and other financial relief. So please, I welcome you to visit us or follow us at California OSBA on social media. So thank you so much. With that, have a great session, learning as much as you can about this next step, the reopening.
Thank you so very much, Isabel. We really appreciate the support that the state of California does in providing the support for the technical assistance providers, but also navigating all the different types of guidance and putting out some very comprehensive documents that we're able to help businesses as they're able to reopen. And so we greatly appreciate that. Now we'll transition over to Champions for Health and allow them to kind of start talking a bit about what they're able to do from what you're able to do from a health perspective, and be able to do that as well. So we'll go ahead and let Andrew do that.
Sounds good. Hi, everyone. My name is Andrew from Champions for Health. I'm just going to share my screen right now. For those of you who do not know us, we are a nonprofit in San Diego County. So I'm assuming that we have a lot of people from all over the state. So hello from San Diego County. It is very hot here today. But we do a variety of things, but we have been tasked on behalf of the County of San Diego to provide COVID-19 presentations. So I know most of you know a good amount, but I just want to do a quick overview, a quick update on some things you may not know. If you are in San Diego, maybe some resources that you could use. And if you're not in San Diego, you could ask your county or talk to your county to see if they are, if they do have these, if any of these resources are available to you. So the presentation that you have in front of you is updated daily, but it is this one that we have was updated on June 2nd. So there may be a few things that may have changed, and I will let you know. But really quickly, most of us know or may know that COVID-19 coronavirus is a viral infection. And as of March 11th, it was considered a pandemic. And it is still spread person to person, and that's the main way that we know now that most people become infected, which is why we're asking people to use a face covering and keep their distance, because people do become infected from person to person, and that's when people sneeze, when people cough, when that leaves someone's body, it's very easy to become contagious, to become infected that way. And we do know now that the virus does not last long on surfaces, but that does not mean that you should not keep cleaning, right? There's still a possibility that you can get, from current slide, there's still a possibility that someone, your kids, your staff, you yourself can become infected. But most people do get infected, or there's higher rates of becoming infected through person-to-person contact. But this is one of the things that I do want to talk about. So symptoms. So when we started doing these presentations back in early March or mid-March, everything that we talked about was if you have a fever, if you have a cough, if it's hard to breathe, call your doctor. Now we have a lot of symptoms that you guys should be looking out for when this comes to your staff, to yourself, your family members, even for your kids. These are the things that you should look out for. And if someone does have, if someone does have COVID-19, you will not have all of these all at once, or even all of them. You can have one or two of them. But this is something that you should learn more about, offer training to your staff, that if a child, a staff member, yourself do have any of these things, to let you know, or to let the county know and the healthcare provider know that, you know, it could be COVID-19 and to go get tested. And as you may know, if you do become exposed, let's say we have a child who may have had COVID-19, they go to your site and they expose a staff member, that staff member may not show any of these until sometime within 2 weeks. So it could be 2 days to 2 weeks, which is why we're asking people to quarantine themselves. And the new ones that were added were nausea, vomiting, and diarrhea. Not a lot of people had these symptoms, but now not a lot of people were saying that they had these, but now the CDC has put this out there that this could be a symptom of COVID-19. Another thing that I do want to talk about as well, and this is specifically in San Diego County, but it could be something that's within your county as well, is that there are testing sites provided by the state. So if you're in San Diego County, there are testing sites in Chula Vista, El Cajon, Escondido, and southeastern San Diego. And if you are familiar with southeastern San Diego, that would be in the Harriet Chavez Center, I believe. And you no longer need a doctor's referral. So this is really important that you communicate to your parents that if they have, if their child has, if they believe that they have COVID-19 or their child does, that they no longer need a doctor's referral. It used to be that you had to ask your doctor, ask a healthcare provider to get referred to go get a test. Now you don't. I know that could vary from county to county, but just so you have an idea of what that looks like, I am going to put that link in the chat, and hopefully we can share this with our folks on Facebook. Let's see. I guess I can't put that. All right. Well, we will share that with you later. But if you're in San Diego County, and I'm assuming that other counties have this resource as well, you can either call that number or you can make an appointment online, but you have to make an appointment. So you can receive a test, but you have to make an appointment and you no longer need a doctor's referral. So again, really helpful to share that with parents and share that with clients if they believe they have been exposed. Another resource that we have in San Diego County is called 211, and that is an amazing resource for anyone who may not have health insurance or a healthcare provider. So if they believe they've been exposed and they want to get a test, they can call 211 and they will be transferred to a triage line and will get connected to their closest community clinic to go get that test or their closest testing site. So just another resource that you could share with your staff or with your parents. If you are in San Diego County, and if you're not, then look into what your county resources are to share that with your parents. And then testing. What is available for testing? So it used to be that we had the PCR test, and that's the test that you saw or that you see on TV, that you see on social media, all the healthcare providers that are in PPE, and that is a nose and throat swab. So this one is the most accurate, and it takes about 1 to 2 days now. I used to take a lot longer, but now we also have an antigen test, and this one is kind of like the PCR test, but it's a lot quicker. And the reason it's a lot quicker is because it's testing for proteins, COVID-19 proteins. And it's kind of the same thing. It's a nose and throat swab, but it may not be as accurate. So what may happen is that, let's say you need to get an antigen test, from your healthcare provider, and let's say you get a positive from that, your healthcare provider may want you to get a PCR test just to be on the safe side to make sure that you have COVID-19. So you could ask for these tests from your healthcare provider or your closest community clinic, or if your county is providing site tests as well too. Again, really good to talk to your parents or your staff members if they believe they've been exposed or have COVID-19. And the last test that we have is antibody test. So this one is where they check your blood to see if you have COVID, if you have had COVID-19, have COVID-19 antibodies. So this one is unique because it doesn't tell us in real time if we currently have active COVID-19. This one tells us if we've had COVID-19 in the past. So I have had several patients and people tell me, well, I think I was sick in December. I think I was sick in February. It might have been the flu. I don't know. A good way to check is to get an antibody test, and then you will know if you have had COVID-19 in the past. So these are the 3 tests that are available, and something to consider if you want to go get tested because you think you might have been sick, or if you think you've been exposed or currently have any of the symptoms that we talked about. Likewise for your staff or your parents too. Another thing that may be available in your county, here in San Diego County we do. I know there's a lot of words on the screen, but it's basically if you do have COVID-19, if you've had COVID-19 in the past, if you're a survivor of COVID-19, you can go to the blood bank and donate blood, and they'll take out your plasma. And I'll share, hopefully we can share that link later. It's I believe a minute, I think, on YouTube that shows you kind of what that is. But if you are a survivor, you can share your plasma, and then we're trying to see if the antibodies from other people, from survivors, can be a good treatment for those who currently have COVID-19. So that's something that you could do as well too, and look into. Talk to your local blood bank to see if that's available for you. Who's at risk? Most of us know, older population, people with asthma, lung disease, any of these things here. But one of the things that you should know is that we also added folks who are Black, Hispanic, Latino. I'm gonna refresh here for whatever reason. So Black, Hispanic, Latino, and Native American people who identify and fall within those races or ethnicities, they are also of higher risk of complications if they contract COVID-19. And this is something to really consider too now with everything that's going on. You know, with all the protests and everything, we know that it is a walk of life, you know, people who really support this, but I don't know why can't share my screen. Let me try this one more time. All right, I will try that later. Oh, there you go. All right, let's see. Slideshow. Meanwhile, it loads. Zoom technology, thanks everyone. So Black, Hispanic, Latino, and Native Americans, they also fall within the vulnerable populations because they're a higher risk. So if you do know anyone who is protesting, just make sure that you stress the fact to wear a face covering, because it could be a lot of people, again, like all walks of life, all ages, but if it is a younger population that is protesting, then they go back to their home who, you know, may have grandparents, who may have parents on the older side, and then they're putting them at risk. So just to be on the safe side, wear a face covering so we can protect our family members and our loved ones. And the other thing I really want to stress about, I can't share my slide here over here or make it bigger, is shots, immunizations. I sit on the immunization coalition here in San Diego. I don't know why I love shots for whatever reason, but we are seeing that there is a decrease in vaccinations for kids and just everyone in between, right? The adults, so the older population. But we really want to make sure that we stress to our parents, to our staff, and even for you guys as as childcare providers, if there is a requirement for immunizations, to tell your parents that the kids need to get their shots, because we don't want to have an outbreak of COVID-19 come into the fall for flu season, and then have measles and pertussis and all of that there as well too. It'll just be chaos. So if you are able to, please have that conversation with your parents and with your staff to go take your kids to go get their shots, to go get their checkups, because it's safe and it's needed. And for here in I'm not sure in all the other counties, but in San Diego County, if and when schools open up in the fall, because they are considered part of that school district, they still need to get their shots, even though they may not be on site to receive instruction. So even though they receive instruction at home, let's say for a couple days or whatever that might look like, they still need to get their shots in order to be considered a student within that district. So another reason to go and have that conversation with your parents and with your staff. And the last thing I want to talk about is kind of what we're doing here in San Diego County. We've all heard of this, flatten the curve, and we're doing really well compared to some other places. But the one thing I want to talk about here is what we're doing in San Diego County for our neighbors. So in Mexico, in TJ, they had a really bad outbreak of COVID-19 where a lot of people got sick. There was a lot of people who were dying. And at TJ Hospital specifically, a lot of healthcare providers got sick and did not return to work. So people, other healthcare providers who weren't trained on COVID-19 kind of took over, but they weren't trained on how to handle COVID-19 and use all the ventilators and all that stuff. So what San Diego is doing in partnership with hospital systems and the county and the government of Mexico is to take teams of doctors, nurses, interpreters, every day to the hospital to go teach these healthcare providers on proper management. And we're doing them from 8:30 to 11:30 for their rounds every day. And we're gonna do this probably until next month. And we're also supporting our neighbors to the east, the Imperial Valley, because they also had a really bad outbreak too. And so we're doing the same thing and trying to support them as much as we can. So I would talk to your county if you're not in San Diego County to see what's available, if they have flyers, if they have someone who could provide you a training. If you are in San Diego County, we are the lead on COVID-19 training. So if you want to do that for your staff or your parents, and we could do this in any language because we have access to all the healthcare providers in San Diego County and work with all the interpreters and translators. We're just a resource for you if you need it. So there's a lot of stuff I can talk about, but I know you want to know a little bit more about childcare protocols and all that stuff. So, I just want to give you an update on COVID-19.
Thank you so much, Andrew. Hi, I am Katy Ibarra from the Women Business Center and Adriana Taboada for SBDC and IRC. We are gonna moderate this panel. So we are very excited. Thank you so much for participating with us. So we have Nancy Maldonado from Chicano Federation. We have Crystal Rasselman and Carlina Shinfield for Renaissance Entrepreneurship. We have Lori Han from YMCA. And what else? Adriana, I am missing someone?
Yes, hello everybody. This is Adriana from the IRC SBDC. We also have Carol Markgrove, who's the interim at the San Diego Regional Office. She's also joining us today.
Perfect. Thank you so much for joining us. So I will start with asking, please take 1 minute to introduce yourself and your organization. We are gonna start with Nancy. So please, Nancy, introduce yourself and your organization.
Hi, everyone. So Nancy Maldonado from Chicano Federation. So Chicano Federation is a 51-year-old nonprofit here in and we have a number of programs that are all geared towards empowering and helping low-income families across the county. And so that includes subsidized childcare, early childhood education, nutrition, affordable housing, and also a program in conjunction with the Women's Business Center where we train women from the community to open their own family childcare homes. So really excited to be here and thank you for having me.
Thank you, Nancy. Now, Crystal, can you please introduce yourself and your organization?
Yeah, definitely. Hello, everybody. My name is Crystal Rasmussen. I'm the program manager for Renaissance Entrepreneurship Center. We are actually located in the San Francisco Bay Area, and we're a nonprofit that's been around for 35 years. Basically, we empower and increase the social entrepreneurial capacities of socially and economically diverse women and men. And we have a partnership with the 4 Cs of San Mateo County to offer the business of childcare. So we do programs around business development, around marketing and finance, and in particularly with 4 Cs, we partner to offer the business of childcare. And I have my colleague, Carlina Shinfield, on the line as well.
Thank you so much. And now we are going with Laurie Han, please.
Good afternoon. My name is Lori Hahn. I am the department head for resource and referral at YMCA Child Care Resource Service. We are the state-funded child care resource and referral agency serving all of San Diego County. We provide referrals to families looking for child care. We also support child care programs by being a referral service for all types of child care centers, family child care homes, and license exempt centers. We're also one of the 2 alternative payment programs in the county, providing subsidy vouchers to families looking for help paying for child care, and those are parent choice programs. So they're able to choose the child care provider of their choice, so then they connect with the resource and referral to provide them with referrals.
Thank you, Laurie. And then we have Carol. So if you can introduce yourself and your organization. Oh, you're muted, Carol. Let me unmute you. There.
Sorry about that. My name is Carol Markcroft, and I am the interim regional manager for the San Diego Child Care Office with Community Care Licensing. We're a division within the State Department of Social Services and have oversight responsibilities for child center programs, family child care homes, in addition to other programs, adult and senior care facilities, as well as children residential facilities statewide. I have some of, you're probably used to my counterpart, Kim Hall, for the San Diego North office, but I am just covering San Diego as Shelley High retired last fall. I have some of my managers from the regional office on the call as well, Jason Gray, Joe Carrasco, Tulum Vu, as well as Robert Garcia and Maria Valencia, some of our assistant program administrators. But thank you for having us today.
Thank you for joining us. So we will start with asking, what are 2 or 3 best practices, tips that you can share for childcare providers post-COVID-19? So we are gonna go in the same order. So we are gonna start with Nancy, then we are gonna go through Crystal, then Lori, and then Carol. So Nancy.
Yeah, thank you. So, I mean, obviously there's a lot of guidance and tips coming out. And so we encourage everybody to follow those. But part of what we do is we go out to family child care homes and do some monitoring and some compliance, making sure that they're compliant. And one of the things that we saw even pre-COVID was sometimes there's, just for whatever reason, there's a tendency to kind of ease up on some of these routines like hand washing and, things that should be in place. So I think post-COVID, these are going to become even critically important, right? Is for childcare providers to set their routines and to make sure we stick by them. I mean, how many of us just in the weeks of COVID that have gone by have eased up on our own hand washing and things that we were really diligent about in the beginning, right? So I think one of the tips for childcare providers is to really establish that routine and stick to it and not let up and not ease up. It's critically important. I think the other thing that we're noticing too is that there's a lot more awareness about where parents are and the things that parents touch. So prior to COVID, there was a real focus on cleaning the areas that the kids touched and making sure that those were all very clean. And now we have a different awareness of making sure that we're disinfecting and cleaning even where the parents are, whether that's, the sign-ins or the door handle, the doorknobs, having them bring in their own pens. So I think those 2 themes are really something that we're hearing from the field, that there's just this renewed awareness and attention to those 2 areas.
Thank you so much, Nancy. So Crystal?
Yeah, I'll definitely piggyback on what Nancy was saying. I think it's so important to continuously, as we've been learning over the last few months, that things are changing. What we thought prior is now changing as well. So I would just say to plan, prepare, and respond, to be able to allow your families and to ask questions and not be afraid to not have all the answers, but hear from them and invite conversations around how comfortable you're feeling as the families that are being prepared to be in the same childcare. I know it's different for each county. In San Mateo County, they're asking that the same group of 12 kids or less stay within that same kind of like bubble. And then also just continuing to check in on the guidances and just reassure your families of the procedures and the guidelines that you're taking and you're following. And then another thing is, if you have young ones, would be to engage them as well, teaching them how to be healthy hygiene and be aware of, you know, them rubbing their nose and not washing their hands. And I think that prior to COVID, that was important, but I think it's even more important now. And maybe engaging them with some games or arts and crafts around healthy hygiene habits.
Thank you, Crystal. Larry?
Well, I would echo everything Nancy and Crystal have already said. Some other things that come to mind are being sure to have clearly defined policies in your contract. I know that we've had several family child care providers who have adapted their policies after COVID, and just having those, making sure you update them, have a sick policy, have those things written, update them on a regular basis, and make sure you share them with families. Be very open with the families as far as whether children will be able to attend post-COVID with, you know, sniffles and such. I know that they're also talking about if children have a history of allergies, that you wouldn't necessarily use those symptoms as a reason to exclude a child, but you need to know that that child has allergies, and not all providers know that. I also want to say, keeping updated with all the information channels that are out there, making sure you're getting the latest information from licensing, from the County of San Diego, if you're in San Diego. The licensing pins are really important as things change. Any funding source that you participate in, any support service like Chicano Federation or IRC, YMCA, just making sure that you are you're receiving that information and that you're reading it and taking it in and asking questions if it isn't clear. Because as we all know, things have changed since COVID started.
I totally agree. It's very important to have resourceable information. So Adriana, please.
Yes, and I also wanted to give an opportunity to Carol, just if you wanted to add anything else from the CCL perspective, Carol. I'm sorry, there you go.
Sure. Just to speak to a recent release as of Friday, the COVID-19 updated guidance, which is put out by the California Department of Public Health in reference to the child care programs and providers, has just an abundance of information in reference to planning for reopening, cleaning procedures. Again, this is for child care providers, hygiene, arrival practices for parents, for pickup, drop off, health screening for your staff, even your children, the parents as well. It also addresses group sizes. And the recommendation is as small as possible, but it doesn't specify a number in the new guidance. So if your local public health county order does specify a size, such as mentioned in San Mateo, the 12, then that's what you would adhere to as well. So it just has an abundance of information that I find very valuable for our providers who are starting to open up, just so they can be prepared, as well as preparing their families as well.
Great, thank you, Carol. And yes, I believe we have also shared the link to those guidance that were released as of June 5th. And as mentioned by Carol, there's definitely a lot of information coming in, but also gladly there are also resources available for childcare providers. And as it was mentioned before, it's very important for childcare providers to be able to plan, prepare, and know how to respond to keep updated with the changes in regards to the communications that are coming from the state, that are coming from the county. And Carol, you just mentioned a very important point that sometimes there's confusion where people don't know whether to follow the state guidance or the local guidance. So thank you very much for clarifying that for our providers. And as a follow-up question, we wanted to see, so what do you see as the biggest obstacle or challenge to adopting a childcare business based on the new guidelines that are available now? And how can providers overcome this challenge? And we can do, Carol, if you want to start, and then we'll go around again.
Okay, and this is just from calls that I've received from providers, but there's a lot of challenges with the social or physical distancing with the children. I mean, it's so difficult because all they want to do is be with each other and connect, especially now after not seeing their little buddies as well. So that is a challenge for our providers to plan for that, educate our kids, educate our parents as well. At the same time, also keeping in mind that we want the same group of children together with the same staff, just for that continuity. And rather than introducing new individuals who may have been exposed to different, situations, we just want to keep that together. So in reference to what they can do to help overcome those, the social spacing, whether you rearrange furniture in your home, in your center, within your ability, whether you utilize outdoor space that you may have available more readily, more often, that can be helpful in these situations as well. Again, talking with parents, talking with staff about the importance and the need to keep those groups together for their safety, for the children's safety, is just the more you can communicate, the better everyone feels with additional information.
Great. Thank you. Very, very good point on how sometimes those spacing guidelines may be challenging. And Nancy, if you wanted to continue, I know that you also have childcare centers under your care under Chicano.
Yeah, so I think the biggest challenge that we're seeing right now is the timing, right? The timing of the business is reopened, but the restrictions on childcare and some of our family childcare providers whose families aren't returning to work yet. So, and the families that are in limbo, but they're still holding the space for that child. So I think the timing of all of this has been really frustrating for our childcare providers, and understandably so. I think that the advice would be, to be patient, because there's obviously nothing more that we can do right now. But I think on our end as organizations is to really, advocate for our childcare providers to try to get some alignment with the timing of this reopening and easing up on some of these restrictions that have been in place. So, I think that the solution to that is for us to advocate more on behalf of our childcare providers and to really listen to them and the challenges that they're experiencing. But I know the timing is really frustrating for them.
Absolutely, thank you. And yes, there's been also comments and questions in regard to, or confusion when they were allowed to start accepting more children now that businesses are opening and they're able to again accept those into the childcare center, but there's some that are still not going back, so definitely a challenge. Crystal, wanted to add to that?
Yeah, definitely. And then I could ask if Carlina wants to jump in after. But yeah, I think definitely communication. One of the things that I think they're struggling with is the comfortability that all the different families are having and the different requests that each family might have. So I just suggest that open communication, explicit instructions on the procedures and the plan, and just so that everything's out there in the forefront. And again, like I said, if the parents and families have questions, just be open to their concerns and be flexible. I think that during this time, it's really important that both the child care facilities and the families be flexible and understanding that every household's different. Everybody has a different concern. They might not be the same for each person, but just really having that flexibility. Carlina, did you have anything that you'd like to add?
Yes, sure. I think one of the things that the child care providers have seen as the parents have a lot of questions about how their kids are going to be safe. And since parents are going to be at home working, some of them, or most of them, have said, I'll keep my child with me. They're not quite sure what's going to be the guidelines, as there are many resources can be confusing. So I don't know if every county is going to have 3 or 4, but I think it has to be set in one guideline that everybody is comfortable understanding. Because I think it's some confusion that, well, this child care provider is doing this and we're doing different. So I think we need to create confidence because parents are afraid. So it had to set some sort of, I believe, a general information for everybody that everybody's applying, and it's not just very diverse and different from every county. That's and I think the providers are questioning themselves, doing enough? Shall I do more? Shall I follow more? So I think that's what they're facing right now.
Absolutely, that is a very good. There's still a lot of hesitation, right? Everybody wants to do what is best in order to limit the spread and to prevent their families and children getting sick with COVID-19. So sometimes the information can be overwhelming, and that's why I'm glad to have all these organizations here together, because we've been working really hard with childcare providers to provide this information and to make it accessible through the Women Business Centers, ourselves, the Small Business Development Center, Chicano Federation, YMCA, and CCL. So that's just a reminder that we are here to provide additional information and support to childcare providers. Lori, I know you've been very involved with sharing these new guidelines within the County of San Diego. Would you like to share your perspective, please?
Well, I would share everybody's perspective that has already spoken. I think a big challenge for childcare programs, both centers and family childcare home, is kind of not knowing of when things will change or will go back to the way it was. And I think that that's hard. Centers probably a little bit more difficult than family childcares because they're going from much larger group size. It's just, a group size of 10 here in San Diego. But just not knowing how to plan for it, not knowing as industries go back to work and they can take back some children, how do they decide which ones they take back? What do they say to the families that are not, they're not gonna have space for? It's really important that they have good communication with the families, and we found that a lot of our family child care providers stayed in really close contact with the parents that were not essential workers, that were not in that first wave of children in childcare during COVID. So they were able to kind of gauge when families would be coming back, if they would be coming back, and better plan for their family childcare. And like we've all said, communication is so important. Just being upfront with the parents about the policies. And I think most parents are very understanding that things are changing and will be changed for quite a long time. If not forever, but just being thoughtful with the way that you share the information with families and having that information available to them, and letting them know, it's hard as a childcare program. One of the things that you look for is that warmth when you enter a childcare center or a family childcare home, and now you're kind of left at the door, and it's hard, it's different. And I think that's going to take a lot of adapting, especially for the providers and the center-based programs that felt more like a family versus, a business setting for children.
Absolutely. Thank you for sharing that, Lori. And yes, that's actually a good transition into our next question. So what would be some of the recommendations that you have for childcare centers, childcare providers in regard to communicating this to parents about and how to better message some of these changes that are taking place within the childcare centers? And Nancy, if you could start us off.
So I know that our providers have been doing a number of things, right? Communicating this whole time, trying to stay away from email, because I think we're all being inundated by email, but, doing a lot of the calls. We've had group sessions where we're kind of communicating all of the changes at once, so that and then people can discuss them, and then childcare providers can talk about how they're dealing with some of these challenges has been really helpful for them too. I know that some of our childcare providers have also done a lot of FaceTime so that they can stay in communication with the kids. Because I think one of the concerns that we're also seeing is that the readjustment that this is going to be for some of the children who have been out of childcare for so long, right? I know that me as a parent, that's a concern, not necessarily for my child, but for me, that I've been around him for, you know, months nonstop. And so, you know, really thinking through that readjustment. So a lot of our childcare providers have taken that into account and have continuously done FaceTime with the kids in their care. But I think a different, doing communication through different methods is going to be the most effective, because some things are going to resonate with some families, some won't. And then really communicating with having that network of other childcare providers to bounce ideas off of and learn from will be critical as we continue with this reopening.
Thank you. I'm trying to make sure I don't lose the order. Crystal, if you could please check.
Yeah, I'll share a few things, and then I'll have Carlina share as well, that she's currently working with our childcare providers. I think that, as Nancy said, it's important to have that other avenue of communication, not necessarily email, but definitely FaceTime or Zoom calls. Get creative. We've seen some of our providers do like dance and activity through Zoom, and have their the kids that were used to being together do a class together once a week, and kind of just have that engagement still. I think that's something that they can do going forward. But I'll pivot to Carlina if she wants to share anything else.
Yeah, I believe that I think FaceTime and Zoom has been really useful for childcare providers, and I believe they can create a lot of even a material that they drop at home from every kid, and then next day or in a week they pick everything and they show on FaceTime or on Zoom, and they are very happy that, you know, whatever they did is shared with everybody. So they're very creative, and some of the childcare providers are really being very creative with imagination and doing amazing things and keep on holding there. But I think communication is one of the main things that they have to do with parents. And of course, I mean, FaceTiming with kids, that's going to help. But I mean, it's a process of adapting everybody probably. And some for the childcare providers is even learning technology. So that's another thing.
Absolutely, like you mentioned, we all had to adapt very quick, including our providers. But like you said, there's definitely a lot of creativity going on, and that we're seeing through our childcare providers on how to address this, right? Lori?
I would echo that communicating with the families via Zoom or FaceTime, where the children can see the provider, and even the parents can. There's something about seeing somebody's face that just makes communication so much nicer, as much as I don't like seeing myself on the screen. But I think that really being upfront and honest with them also, as parents are asking, you know, when will you be able to expand? When will you be able to take more children? All the things that have been happening with providers, wondering when they can go beyond essential workers to when can they expand their group size. Just be upfront and honest with them. And I think that parents know that a lot of the stuff that's going on is completely out of their hands. And then just, you know, forewarn parents before they show up at your door that you're going to have a different check-in and check-out and drop-off policies and stuff like that, and that things might look a little bit different, and you're going to wash your hands a lot, and then just talk with the children about the same things. Explain why you're washing your hands, and most kids don't like washing their hands all the time, but you know, we know that that's the best way to keep the disease away from us.
Carol?
I just wanted to add, in addition to communicating so well with the parents about what they can expect coming back to the child care center or the family child care home, is that the provider really have a solid plan as to what that's going to look like, where they're going to have their hand sanitizing station, where are we going to have drop off, where are we going to have pickup, and notice parents that those practices will change. There'll be health screening questions that we recommend that they ask of their staff as well as their parents. And, you know, even whether it's Zoom or Skype, what have you, the formatting for communicating, if they can even show them when you walk up, this is what you're going to see, so that the parents have the best understanding as what they can expect. Take that element of surprise away from them so they can feel a little more secure as to what they're going to encounter when they drop off their child at the program that day would be, you know, ideal with that communication element.
Thank you so much, Carol. And then we have our last question for the panel. What additional resources are out there for childcare providers? So Nancy, we know that we have Chicano Federation, so.
Yes, obviously we are a resource for childcare providers. So anything that we can help with, particularly one of the things that we've been asked a lot about is helping for our Spanish speaking providers who in their, you know, a lot of this information isn't necessarily coming out in Spanish. So if anybody has any questions or is unclear, you know, please contact us. Also, you know, in our, we have a partnership with a lot of partners, including YMCA, where we have been supplying cleaning supplies for childcare providers. So please, if you haven't seen those emails come out or you haven't been able to sign up to be a part of that distribution where we're distributing cleaning supplies and now diapers and laundry detergent, I urge you to please reach out so that we can get you that information. Also, Chicano Federation does the CACFP program for family child care homes. So, you know, getting some assistance with the nutrition, the cost of the food that child care providers serve in their homes. So if you're not tapped into that program, please contact us. And then last, but certainly not least, is that we'd be remiss not to address, you know, what is happening right now in this current climate, and that these conversations are going to come up with the children that are in their care, and knowing how to address some of these conversations about race and the things that are happening, because children are sponges and they are seeing and hearing and taking in everything that is going on. So part of what we're doing is also having those conversations with experts. So we have one actually coming up next week, and this one will be all in Spanish, and it is specifically geared towards parents, childcare providers, educators, about how to talk to children about what is going on right now and the things to say to them. So, you know, I'd encourage any childcare providers to please, you know, also, you know, do some research and kind of educate themselves on the appropriate ways to address these issues, because they will come up and children will ask questions and conversations will be happening. And, you know, we do have a responsibility to address those concerns.
Thank you so much. Andrew, do you want to share something with us?
Sure, I will. So this is specifically for SD County, but you can check to see if your county does have another resource. So there is an email that I'm going to put in the chat, so hopefully we can share it with our Facebook folks as well. But if you email this email, the county does have PPE. So that's masks, face shields, and thermometers that they can give to childcare providers. And if this email has been out for a while, so if they don't have that available, I have access, and again, unfortunately, it's only for our county, but I have access to all the doctors and nurses and hospital systems in San Diego County, and a lot of them may have some extra supplies. So I'm gonna put the county email first in the chat, and I'm also gonna put my email in the chat as well, just to be used as a resource. And again, if you need just an overview on COVID-19 presentations in any language, I'm happy to help as well too, or offer translation or interpretation for any of these things too.
Thank you, Andrew. Crystal and Carlene, do you want to share something?
Sure, and thank you, Nancy, for pointing out how to talk to children during this time. I think that's really crucial and important. If you could share that information in the chat as well, that would be very helpful for us. We are in, like I mentioned, San Francisco Bay Area, and the coverage of is San Mateo County. I'll go ahead and put it in the chat, but we work with 4Cs, the Child Care Coordinating Council. in San Mateo County, so they're a resource. And also we're available for one-on-one consulting with our clients who live in the area.
Carlina, do you want to add something?
I will say that probably it's really important, the one-on-one consulting, because sometimes, you know, as right now I'm offering a class to child providers, sometimes there are specific questions that are easy for them. Everybody share, but sometimes they feel more comfortable doing one-on-one. And I reinforce, like everybody has said, communication is critical. No matter what is the way, we need to learn to address in order to respond to all the questions that you have. So we're helping with one-on-one and of course through the program and the classes and everything. So I believe communication is the most important thing. Thank you.
Thank you for sharing that. Also at the Women Business Center at SBDC, IRC, we can help you with that with technical assistance with one-on-one business advising. Larry, do you want to share something, some resource?
Sure. We've been working with the regional hubs, like Nancy talked about, distributing cleaning supplies. We're having our second distribution this weekend. We also have a trauma-informed care training about resiliency during the COVID-19 pandemic that's been made available, and it is also available. We offer it on a regular basis on Zoom through our training portal. We also have the SB 89 cleaning and supplies funding for childcare programs, and so that is a large allocation of funding that childcare providers can either choose supplies or funding for that. And then we're having forums, regular forums with family childcare providers, one in English, one in Spanish, and also with center-based programs. So they can just learn and support each other, ask questions, how are they doing things. We found during our county's been having these telebriefings every week. It's now going to every other week. And a lot of providers are just asking, like, how are you doing to, you know, groups of 10 in a center? How are you dividing your classrooms to make it into 2 groups and stuff? So so those forums have been well attended for them to just support each other and learn from one another and ask questions.
Thank you so much, Laurie. That is very important. We had a lot of questions related to that. So yeah. Carol, something that you want to add?
Sure. So in addition to our local resource and referral agencies, we do have our San Diego regional offices with community care licensing available for assistance. Of course, consult with your county public health office as is appropriate. On our website, we do have provider information notices that many of our child care providers receive automatically. They've subscribed for those updates, but anyone can go online and take a look at those because they're all public information. In each of our local offices, we are initiating phone calls to our licensed providers. We're not going out in the field right now, but we're trying to conduct tele-inspections and provide technical assistance. You know, do you have a hand washing station or your sanitation area set up? Let's help you get set up and provide you with some tools to assist. So really, that's what our role is at present, is to provide that technical assistance. So those would be our resources. Thank you.
Thank you. And now we have you, Carol, in our agenda to provide a presentation about the state services.
I'm sorry?
That we have you in the agenda to provide us a presentation about the state.
She was just going to be on the panel. So.
Oh, okay. Okay.
Yeah, so we can go. We're actually about out of time, so we'll kind of wrap up and thank everybody.
Okay, Adriana, you can help us.
Yeah, just to add, so thank you so much, yes, Carol, for mentioning the telebriefing. So yes, another resource that we have from the IRC SBDC is that we're going over some of the questions, you know, in order to help providers prepare themselves for the telebriefing. The analysts have been extremely helpful to work with our providers as well. In our case, we also provide services in other languages in addition to English. So we have Arabic, Farsi, Swahili, so we're able to work with those providers who may have a difficult time because of language barriers. Something else that I wanted to mention, especially in San Diego, is that there's the telebriefing, there's the calls organized by the county. So those are bi-weekly. So the same, reach out to your county, make sure that you're getting those emails and updates. These calls are extremely helpful to provide updates as they take place. And lastly, as the SBDC and WBC, in addition to providing you with technical assistance, so you can meet with a business advisor one-on-one to help you prepare your plan, to look over your reopening strategy. But in addition to that, you can also access to capital. A lot of the times what we're seeing is that providers find themselves that right now they don't have the resources to, rearrange furniture, buy new materials, from like buying thermometers, or just something that may seem as a small amount, but again, especially in these times, it may be a burden for providers. So you can talk to your business advisor in order to receive assistance, applying to local grants, applying to loans provided by the SBA. So definitely use this as a resource. Thank you.
So with that, we can finish our panel. Thank you so much for joining us today. It was a great panel. I really enjoyed it.
Thank you. And lastly, this is Andrew from Champions. We do other stuff, but just want to say that we are hosting a Zumba class at the end of the month. I know this is a heavy topic, so it's just here to help you guys de-stress. So I put the registration in the chat. It's the end of the month at 11:30. Come and shake it so we could go and keep our fitness on. Thanks, everyone.
So thank you, everybody. Thanks for those of you joining us on Facebook Live. I want to give a great thank you to everyone that presented from the state of California, from local providers. This has really been some fantastic information. The California Women's Business Centers and the California Small Business Development Centers were probably about 100 different service locations around the state, and probably about 1,000 different staff and advisors up and down the state as well, to be able to provide you that one-on-one assistance. So we thank you for that, and we appreciate everybody and everything that you've done. So we hope you all have a good day.